Hi, my name is Laura. I'm going to be telling you about the symptoms, signs, and transmission that are associated with the herpes simplex 1 virus. I am actually speaking from firsthand experience as I am a carrier of the virus. So everything I'm going to be talking about I have experienced personally. During the initial primary infection, when the virus first enters the body, many people will experience high fever, muscle aches, swollen lymph nodes, and other flu-like symptoms. During the subsequent outbreaks, usually a day in advance, carriers will experience a tingle, an itch. Some people describe it as a burning sensation at the site where the virus is going to be surfacing, as you can see in this picture here. So the site that it does surface is usually on the mouth or near the mouth. It can be inside the mouth, though it can also come up on anywhere on the skin of the body, though it's less common. The sores are known as cold sores or fever blisters. They're kind of the infamous hallmark of the herpes virus. And as you can see in this picture here, they are made up of these little fluid-filled blisters, and the fluid inside the blister starts to weep or leak after about 3 or 4 days of the blister being present, and about 4 days after this, the sore will begin to heal with a crusty scab that's usually yellow or kind of a darker pigmentation. So there are some carriers of the herpes simplex 1 virus who actually don't experience any signs or symptoms at all. The viral shedding still occurs, but without any visible signs. It's known as asymptomatic shedding. So there is still a risk of transmission during this time, and no one really knows when the shedding is happening because there's no symptoms of it, but the risk of transmitting the virus during this is estimated to be lower than 1%. So it can happen, but it doesn't happen very frequently. Usually the virus is shed and is passed to other hosts and infects other hosts while there is a fever blister present. The virus can be passed from the fluid that's inside of the blister, which is very contagious, or it can also be found in just other bodily fluids of the host, such as saliva. So even things that don't come in contact with the fluid of the blister can still be contagious. So this makes the common ways of transmission to be skin-to-skin contact, such as kissing, or sharing items that have come in contact with the site, such as lip balm, eating utensils, drinking from the same cup, using the same towel, or other such things. And the virus will enter a new host through broken skin or a mucous membrane, such as inside of the mouth. It can also be passed in through the eye, and if you get a cold sore or a virus sore on the eye, it can potentially leave scarring, can affect vision, or even cause blindness. It can also enter, if it comes in contact with the genitals, it becomes herpes simplex virus 2, which is commonly known as genital herpes. As you can see here, there's a statistic from the National Institutes of Health that estimates that by the age of 50, approximately 90% of adults have been exposed to the herpes simplex 1 virus. So this doesn't necessarily mean that these people have become infected with the virus, but just that they have been exposed, similar to if you are exposed to a cold, you might not get it, but you have been around it. The statistics for carriers, though, are equally shocking. So you can see in this graph here, the orange represents people who are infected. So 62% of adolescents are already carriers of the herpes simplex 1 virus. And by the time that adults reach the age of 60, it's estimated that anywhere as high as 85% have become infected with the herpes simplex 1 virus. So it truly is ubiquitous. But here to tell us a bit more about prevention and treatment for the herpes simplex 1 virus, we have Jaron.